PHN and PSA Drug and Alcohol forums have really been a great opportunity to bring a broad range of healthcare professionals together to help identify people that may be misusing different medicines or illicit substances, look at what the best treatment might be for those patients, how to initiate sometimes those difficult conversations that you need to have with patients so that they get the best care, and then also looking at what referral pathways and networks might be available to support patients so that we achieve the best outcome possible.
We were here today to provide some training and some skills for a range of professionals who work in primary care, predominantly pharmacists, but also some general practitioners, psychologists and nurses. And what we were helping them to do was to intervene with people who have prescription drug problems, because we know there's increasing problems associated with prescription drugs, and we've seen increasing rates of death in young people associated with prescription drugs, so we were helping them to pick it up earlier and to stop people from developing harms, down the track.
This is a great opportunity. We've got pharmacists, psychologists, some GPs, everyone coming together to talk about a really important issue. And Health Pathways is a fantastic tool to facilitate that. We're learning a lot today. There's a lot of information that's being shared, but Health Pathways allows you to go back and have a look at the clinical information that you learnt about, but very importantly to look at referral options. So the other important aspect of Health Pathways is the patient information. From Health Pathways you can link through to the patient information site where you can direct patients so they can look for their own information, but clinicians can also work through the Health Pathways site itself to find patient information leaflets which they can print off and actually physically give to the patient.
Primary care is of course where people present first, and it's also where people can be seen over a period of time, and so primary care is an ideal place to try and intervene earlier.
Not everyone sees the pharmacist as a partner in healthcare when it comes to drug and alcohol related problems. However, more and more so now with changes in legislation and also programs that the government is funding, pharmacists do have a greater role to play in supporting patients that may be misusing.
Today it was really cool to see a sort of a wide range of views between some doctors and some pharmacists about, I guess, the changing trends and the history of sort of benzodiazepine use and opioids, and I guess the other sort of whole addiction profile.
I found today quite an enriching experience, bringing together a multidisciplinary approach to managing drug and alcohol dependence issues. Very timely at the moment too, with the codeine over-the-counter sales being restricted to prescription only. I think we're going to be finding that people might become a little bit more desperate as they need to control their pain, and maybe not all the tools are there for them to self-manage. So today's provided the opportunity to, address those issues and help people out a lot more.
The pharmacy is an ideal place to intervene, where people can still, live their lives. It's part of the community. They don't have to be seen to be presenting to a hospital or to a clinic. They just go and pick up their medication and get support from the pharmacist and then go about their normal lives.
I think the benefit has been that we've been able to bring experts together to design a program that might be tailored to pharmacists but is also applicable across different healthcare professionals. And I guess I've really enjoyed that, because with our knowledge and the PHN's knowledge, we've been able to work together to, achieve what we think is the best program that we could deliver.